Hello and welcome everybody. This is Dr. Hani Nadim. This lecture will cover the anatomy of the palm of the hand. By the end of this lecture, you should describe the anatomy of the skin, the fascia, whether superficial or deep, and the muscles, whether extrinsic or intrinsic. The skin of the palm of the hand is characterized by being firmly adherent to the underlying superficial fascia, preventing its rolling. This helps in making the grip of the hand as firm as possible. A nerve supply of the skin is by the median nerve on the lateral 2/3 of the palm and the lateral 3.5 fingers, and the ulnar nerve on the medial 1/3 of the palm and the medial 1.5 fingers. The deep fascia makes many thickenings. It makes the flexor retinaculum, which we have studied already. It makes the palmar aponeurosis, this triangular fascia. It makes it contains the palmaris brevis muscle, which is a muscle in the superficial fascia that helps the grip. It contains the superficial transverse metacarpal ligament, and it is thickened in the fingers to form the fibrous flexor sheaths, which protect the flexor tendons on their way to their insertion. First, the palmar aponeurosis is a triangular thickening of the deep fascia of the palm between the thenar eminence and the hypothenar eminence in the center of the palm. Its apex is attached to the palmaris longus muscle and to the edge of the flexor retinaculum. Its base splits into 4 slips. Each slip winds around the edges of the one finger of the medial 4 fingers to be attached to the deep fascia on the dorsum. Its function, as it is attached to the skin, it improves the grip, and as it covers the deeper structures, the nerves, the vessels, the tendons, it protects these structures from compression. There is a pathological condition. Sometimes there is inflammation in the medial part of the palmar aponeurosis, and this leads its fibrosis and the contraction, leading to a flexion in the metacarpophalangeal and the proximal interphalangeal joints of the medial 2 fingers. Usually the distal interphalangeal joints is not flexed. It's called the Dupuytren's contracture. Structures that lie deep to the palmar aponeurosis are the superficial palmar arch, which is made by continuation of the ulnar artery. The terminal branches of the ulnar nerve, the superficial terminal branch, which is subcutaneous. The terminal branches of the median nerve, and the long flexor tendons. There are 20 intrinsic muscles of the hands. It can be divided into groups of 4. For the thumb, there are 3 thenar muscles plus adductor pollicis. To the little finger, there are 4 muscles, 3 hypothenar muscles and palmaris brevis. There are 4 lumbricals, 4 palmar interossei. The first one is rudimentary, and there are 4 dorsal interossei. So remember, you have 20 muscles in the forearm and 20 muscles in the hand. Now we will study the thenar and hypothenar muscles. The thenar eminence is made by 3 muscles, 2 superficial and 1 deep, and similarly the hypothenar is made of 2 superficial muscles and 1 deep. The superficial muscles, the outer one is usually abductor, and the inner one is flexor, whereas the deep one is opponens. So in the case of the thenar muscles, we have abductor pollicis brevis laterally, flexor pollicis brevis medially, and deep to them we have opponens pollicis. They are attached to the, or they arise from the lateral end of the flexor retinaculum and the two bones to which it is attached. They are inserted into the proximal phalanx of the thumb, in the case of opponents to the first metacarpal bone. They are supplied by the median nerve, and as their name indicates, the abductor abducts the thumb, the flexor flexes the thumb, the opponents causes its opposition, and I will revise with you now the movements of the thumb. But first we will cover the hypothenars. There is abductor digiti minimi, superficial and lateral, flexor digiti minimi, superficial and medial, opponents digiti minimi, deep to them. They arise from the medial end of the flexor retinaculum and from the two bones from which it is attached. They are inserted into the proximal phalanx of the little finger, except the opponents, which is attached to the fifth metacarpal bone. They are supplied by the deep branch of ulnar nerve, and their actions as their names indicate. The fourth muscle to the thumb is the adductor pollicis. It has two heads, a transverse head and an oblique head proximal to it. This arises from carpal bones. This arises from the middle metacarpal bone, the third one. And both are attached to the base of the proximal phalanx of the thumb. Its action is abduction, and its nerve supply is the ulnar nerve. The movements of the thumb are shown here clearly. First, abduction occurs in, remember, abduction is up. Your thumb should go up above the plane of the other fingers. When you return your thumb, this is adduction. When extension is the thumb moves in the plane of the fingers, away from the others. Inflection, it is brought close to the other fingers. Opposition is when you count your fingers using your thumb. Reposition is when you return the thumb to its original position. The palmaris brevis muscle is one muscle that lies in the superficial fascia. It's attached to the medial side of the palmar aponeurosis and to the deep fascia of the hand. It hollows the palm, making the grip better, and it is supplied by a superficial branch of ulnar nerve. We have four lumbrical muscles. They arise from the tendons of flexor digitorum profundus. The first two are unipinnate, arising from one tendon. The third and fourth are bipinnate, arising from two tendons. The tendons of lumbricals wind on the lateral aspect of the finger on which they act to reach the dorsum of the finger, of the proximal phalanx, where they join the extensor expansion of this finger. The extensor expansion, which is at the insertion of extensor digitorum, has a base which splits into three divisions. A middle slip that is attached to the middle phalanx, and two collateral slips that separate and reunite to be attached to the distal phalanx. All lumbricals are bringing the fingers to the writing position, that is to say flexion of metacarpophalangeal joints of the medial four fingers and extension of their interphalangeal joints. The first two, which are unipinnate are supplied by the median nerve. The medial two are supplied by the ulnar nerve and are bipinnate. And now regarding the interossei, we have 4 palmar interossei and 4 dorsal interossei. The palmar are adductors, the dorsals are abductors. Adduction and abduction occurs in relation to the axis of the middle finger. So the palmar interossei adduct the first and second digits, the fourth and fifth digits, towards the central axis of the middle or third digit. So the first is concerned with the thumb, the second, but the first is rudimentary. The second arises from this metacarpal bone because they are unipinnate. Each arises from one metacarpal bone. The second from the second metacarpal, the third from the fourth metacarpal, and the fifth from the from the fifth metacarpal. They arise from the sides closer to the middle finger. And they wind around the finger to reach its dorsum, where they are inserted into the extensor expansions. They are all supplied by deep branch of ulnar nerve, and as I said, they are adductors to these fingers. The dorsal interossei, on the other hand, are abductors and are bipinnate. So they arise from 2 adjacent metacarpal bones. They act on the middle 3 fingers only. They are 4 muscles, but they are distributed to the middle 3 fingers. Why? Because the thumb has its own abductor. We have the abductor digiti, abductor pollicis, brevis. And the little finger has its own abductor, the abductor digiti minimi. So these 3 fingers receive 4 abductors. For the index, the first one, to abduct it away from the middle finger. The second and third are attached on the 2 sides of the middle finger itself to bring it to this direction and to the other direction. So it is abducted from its middle axis. And the last one is attached to the ring finger, where it pulls it away from the middle finger. They are all supplied by the branch of ulnar nerve, and they are abductors. Now we reach the end of this lecture. Thank you for listening. If you like these lectures, please subscribe to my YouTube channel and hit like. Thanks.